But you can imagine that happening. And those two instances stick out of my mind because I realized there has to be a place for these people to go who need this type of care, but a long-term care typical unit might not be appropriate, and we need to look at maybe some other solutions that would be more appropriate.
Hey out there, welcome back to the Nursing Home Abuse Podcast. My name is Rob. I'll be your host for this episode. Today we're talking about the challenges of caring for nursing home residents that are also recovering. But we're not having that conversation alone. We have the fantastic Tina Baxter on to walk us through that process. Before we get into that, it is now time for the nursing home regulation question of the week and another opportunity for you to ignore my pleas for you to please participate in our giveaway and win this Nursing Home Abuse Podcast mug. Perfect for coffee, tea, whatever your beverage of choice is. You win it by answering the nursing home regulation question of the week on our TikTok. So go to our TikTok, which is at Justice for Residents. Find the question of the week video for this week. It's going to be the thumbnail that has a Doritos Locos taco on it. So you're going to click on that. You're going to answer the question of the week and let us know what your favorite fast food taco is. Is it from Del Taco? Is it from, I can't think of any other place that has tacos besides Taco Bell. Doesn't matter. Like, you shouldn't be going anywhere to get a fast food taco other than Taco Bell. And then at Taco Bell, you should be getting nothing other than a Doritos Locos Taco Supreme. Perhaps, depending on the season, you get a Cool Ranch. But for the most part, it should be a nacho cheese Doritos Locos Supreme. So come on, give me a break. Random winner will be announced on Sunday on TikTok and at our website, shinkfirm.com/podcast/giveaway. Your mug will ship at the end of the month. Good luck. Difficulty this week, folks, is easy. So I'm going to even say you can have no knowledge of nursing homes or the regulations and get this right. So this is your opportunity to win this mug. Under 42 CFR 483.21a, which of the following must be included in the resident's baseline care plan? Is it A, the resident's favorite TV shows and ideal vacation itinerary, B, a signed autograph from the attending physician for morale boost, or C, initial goals based on admission orders and therapy services? It's a good thing this one is so easy because I just butchered the execution of it. The answer is C, a baseline care plan, which is required to be put in place within 48 hours of admission to the nursing home, requires initial goals based on the resident's admission orders. All right. Once again, we are talking about addiction recovery and nursing home residents, but we're not having that conversation alone. We have the terrific Tina Baxter on the show. Tina Baxter is a board-certified gerontological nurse practitioner and owner of Baxter Professional Services, LLC. With over 20 years of nursing experience, she provides legal nurse consulting, wellness coaching, and training for healthcare organizations. She's also the founder of Nurse Shark Academy, where she mentors nurses and businesses, a national speaker, and podcast host of the Nurse Shark Academy podcast. Tina has been featured on entrepreneur.com, The Minority Nurse, and other media outlets, and we're so happy to have her on the show. Tina, welcome to the show.
Thank you. Thank you for having me.
Okay, so I guess straight away, the nursing home population would probably not be any different than the population at large. There are going to be some people that are recovering in the nursing home, right? So what are, in your experience, some of the more common addictions within the nursing home population?
I would have to say alcohol. That is a very common one, particularly those that have had a long history of alcohol abuse. Sometimes it, leads to some dementia and memory loss and things like that. And then opiate addiction. That is another big one that we see, particularly because, chronically, people that are in a nursing home oftentimes have a lot of chronic conditions, right? They've had a lot of health issues. And so sometimes there becomes some substance abuse related to prescription medications and misuse and overuse.
So how, if at all, how are these things treated? What is the treatment for someone that is an alcoholic or is addicted to opioids?
Well, oftentimes, by the time they get to the nursing home, if they're acute, obviously we're going to have them hospitalized. They're going to go to the hospital for detox because we can't handle that level of care in a nursing home, particularly with alcohol or benzodiazepines. There's a really big risk for seizures and things like that. But they're in the recovery phase, and we're going to do everything we can to keep them in recovery, monitoring their medication and what they're taking, encouraging them if they are still able to get out into the community to attend their 12-step meetings and whatever else that they're doing, and just being there to encourage them to maintain their recovery.
Talk about from a broad standpoint. I guess I never realized that, but what are the phases of treatment? So there's like literally like I guess inpatient for alcohol addiction or whatever it is, and then they leave the inpatient, and there's outpatient, and then there's the programs. Kind of walk us through that.
So there are several steps that you can come into the continuum for addiction treatment. So what people most think about is the acute inpatient stay, and then they think of the 30-day program that we used to have traditionally, where you stayed in for 30 days. Well, most places now we don't really have a lot of 30-day programs, so it's usually just acute detoxification where you're in the hospital and they give you medications to help you come down from whatever you were taking. So if you were abusing heroin or opiate pain medication or alcohol, they can help you get off of those medications safely in the hospital. Again, there's a big risk for seizures and other complications when you try to do this cold turkey on your own. And most people don't make it through because the pain of the withdrawal sometimes is so difficult, particularly if they have pain medication and opiate withdrawal, because the body is sending you pain signals so you can go out there and seek more of the medication. And so it comes like this feedback loop. So once you've achieved your detox, then we move more towards the recovery phase. And that could be a partial hospitalization program where you go most of your day to the program, attend classes, you get seen by providers, medical providers, maybe even provided medication assisted treatment, or we call it MAT. So maybe you're put on medication like buprenorphine or methadone to help maintain your sobriety. Those could be things that we offer as well. Some will come in and get their Vivitrol, which is a brand name, but it's naloxone that you can get in a shot form that helps you with your alcohol or opiate addiction treatment. And you can get that started in the hospital, and then we can continue that in the nursing home as well.
That sounds like a potentially like a lot. So like, what are some of the challenges like when you have a nursing home resident, perhaps that's maybe not lucid all the time, for example? Like, what are some of those challenges getting that addiction recovery treatment to them?
Well, oftentimes it really depends on the individual client. So if you have someone that maybe have some memory issues, it's a matter of environment, making sure that what they have isn't readily available. I remember we had a resident in the nursing home who had an addiction to alcohol, and he got into the hand sanitizer because it was just readily available. Nobody thought about it, but it's one of those things that you have to look at the environment and make sure that it's safe for that individual. And so there may have to be some changes. So we ended up removing the bottles, the hand sanitizer from the wall because of that, and put it behind locked doors because we wanted to make sure that he couldn't get back into it and supporting his recovery. In other cases, it could be just a matter of providing that continuing education to the client, to the resident, and saying, hey, this is for your treatment. We're going to continue your antabuse for a while. Maybe they're on antabuse as a deterrent. That way, if they go out into the community, they're out with family, then possibly they could keep them from relapsing. We also will educate the family about some of the dangers of the possible relapse. We had an incident once where the physician was coming into the building and happened to observe the resident sitting in their truck with their son smoking marijuana. And of course, the resident denied it, but the doctor's like, yeah, I just saw you and I can smell it. And so we educate, because they may be on medications that will interfere with the marijuana, may interfere with their medications. And we've had instances of people that have been on marijuana in particular for a very long time that may cause some GI issues and cause hyperemesis syndrome. And a lot of people don't know that. And so because they say, well, it grows organically, so it must be safe. I said, well, there's a lot of poisons that grow organically too. And so you just have to weigh the risks and the benefits with the individual, and do some good education as to why they're taking what they're taking, and how to take it effectively and safely, and letting the families know that if your elders coming to visit, make sure the medications are locked up and in a safe place so they don't have access to it, particularly if they have memory issues, because they may forget they've already taken their medication and take it again, and that could lead to disastrous consequences.
Sounds like the nursing staff are the front line of defense in terms of recovery progress. Like they get a lot of weight on their shoulders.
They do. And unfortunately, in nursing home care, there isn't a lot taught about how to handle someone with an addiction. So that's the other piece that needs to be added, is helping the nurses understand what it's like to deal with someone who has an addiction issue. And also, if they have a comorbid, a psychiatric illness as well. We see a lot of the people with chronic mental illness that are aging out of the psychiatric system, meaning they're no longer appropriate for the group home because their physical health needs are greater than what the group home can handle. But now they're placed into a nursing home. And what does that mean when they're having a psychotic break? Couple that with an addiction issue, and those comorbid conditions can make it a little difficult for the staff. And not having adequate training, then kind of makes it a little dangerous to have some of these patients in there if you don't know how to watch out for those risk factors.
I would imagine too that it would be kind of like a conflict if and barring anything that's illegal that the person might be addicted to, just stay to alcohol and maybe depending on what state you're in, marijuana, where it might be their preference to do it, right? Like there's that
Yes.
conflict.
Yes. And again, we look at residents' rights. Residents have the right to live their life. That's their home. And so we kind of tailor that. So for example, one of my buildings, they have a happy hour. Every Friday it's happy hour, but they're limited to, you get 2 drinks.
Yeah.
That's it. You can't get any more at the happy hour. So if they want to go out with their family and friends and do whatever they want to do on their weekend, we can't stop them from that. We can educate them. We had an incident once in the nursing home where all of a sudden this guy kept falling out of his wheelchair. He just seemed like he was very lethargic, and nursing staff couldn't figure out what was going on. And so one day he face planted out of his wheelchair. And we figured out it was because he was highly intoxicated. Suddenly he was getting friends from the city, that popped up, and they were visiting him every day, bringing him something he shouldn't have, because he did have an addiction issue. And we had to have a conversation with his family, to because he wasn't able to make competent decisions, to bar those individuals from the facility because they were contributing to some problems that he was having.
Yeah, I can just imagine that being a tough situation, particularly when maybe the family's not as supportive as they should be, where
Yes.
you know, it's sad, but if they're coherent most of the time, if they want it, I guess you gotta give it to them.
Yes. And unfortunately, we've had some cases where we've had younger people. Now, let's talk about this because it is happening, where there are younger people, and I'm talking about in your 40s and 50s, and sometimes even in your 30s, who get admitted to a nursing home because they need to have IV antibiotics because maybe they have a bacterial infection in their heart because they were using IV drugs. And so now they don't want to keep them at the hospital. They don't need acute care, but they don't want to send them home with IV access. So they come to the nursing home for treatment. The problem is unlike a psychiatric unit where there's a lot of restrictions on who can visit and when, and bags have to be searched and all those things for safety protocols. In long-term care, oftentimes people come in freely to visit, and we don't check their baggage. We don't check what they give people. And so we had a couple of incidents where people had IV access and actually used illicit substances in the nursing home because their friends brought it in to them. And then we had an overdose situation that we had to get them shipped back out to the hospital. And this is pre-COVID, but this is when all of a sudden we had a really big uptake in overdoses and things like that. And people were in the hospital for all these bacterial infections. And the nursing home would say, hey, we got to fill these beds, so let's go ahead and bring them in. And I'm over here as the, nurse practitioner and who'd worked in addictions and psychiatry, and said, hey, the nurses really aren't prepared for this. Staff isn't prepared for this. The social worker, which you only have one in the building, they're not prepared for this. Is this really a good idea? And we got pushback from corporate to say we had to take them. And of course, these negative consequences occurred. And then all of a sudden they said, maybe this isn't a good idea, right? Because you aren't prepared for that. And we had another incident where a younger person who was, and with a little mild withdrawal still, was on our unit because he had IV access. And so on the unit was also our 80-year-old dementia resident, the typical nursing home patient who calls out, help me, help me, help me all day. And so can you imagine, you are not feeling well, you're hooked up to IVs, you're young, you're stuck in a nursing home next to someone who says, help me, help me, help you all day. You're already irritable because you just got detox, you're new into your recovery, you're still feeling terrible. And I'm not excusing this young man's behavior, but he got really frustrated and pushed the elder into the wall in his wheelchair, just shoved him into the wall. So obviously, of course, we had to get him out of the building as well, and have the other person checked out. Fortunately, the resident wasn't seriously injured, but you can imagine that happening. And those two instances stick out of my mind, because I realized there has to be a place for these people to go who need this type of care, but a long-term care typical unit might not be appropriate, and we need to look at maybe some other solutions that would be more appropriate.
Tina, are you a podcast host? Is that what I understand?
Yes, I am a podcast host. I have the Nurse Shark Academy show where I interview nurse business owners.
Oh, cool. Wait, what is it called again?
The Nurse Shark Academy show.
Awesome. Okay. Well, Tina, I really very much appreciate you coming on the show and sharing your knowledge with us today.
Thank you.
Well, folks, I hope you found this episode educational. If you have any ideas for topics that you would like for me to discuss, please let me know. If you have ideas for people that you want me to talk to, please let me know that as well. Also, please enter to win the Nursing Home Abuse Podcast mug. Just do it. Stop thinking about it. You're on the fence, get off the fence. I need to get rid of these things. I got to unload 100 mugs. So just get one. New episodes of the Nursing Home Abuse Podcast come out every single Monday. And with that, folks, we'll see you next time. Thanks for tuning in to the Nursing Home Abuse Podcast. Nothing said on this podcast, either by the host or the guest, should be construed as legal or medical advice, nor is intended to create an attorney-client relationship between the host or their guest and the listener. New episodes for now are available every other Monday on Spotify, Apple Podcasts, or on your favorite podcast app, as well as on YouTube and our website, nursinghomeabusepodcast.com. Again, that's nursinghomeabusepodcast.com. See you next time.